the most important program, and going forward, what's happening legislative-wise in that area.
Happy birthday to you.
Happy birthday to you. Happy birthday, Medicare. Happy birthday to you. And many more.
One more time, yeah.
Happy birthday to you. Happy birthday to you. Happy birthday, dear Medicare. Happy birthday to
Many more.
So thank you everyone for celebrating the 49th birthday anniversary. We've had Medicare since 1965, and it covers millions of Americans across the country that have a disability, that are retired, and so it's a great program, and we know that in administrative costs, it's a program that takes very little of the administrative costs. It's more invested in healthcare coverage.
I didn't have insurance coverage until I became disabled. And then I got Medicare and Medi-Cal. And thank God, because I'm now the bionic woman.
The reason I joined Medicare was to augment and give myself another way of having health care as I'm aging.
I'm glad I qualified for Social Security. It's paying for my Medicare. Everybody should have health care. Health care is a right. Everybody in and nobody out.
They always have came through for me. I have never had a problem with Medicare. It always worked.
Medicare is a component of the Older Americans Act. The Older Americans Act expired in 2011. It's still going though because they have ongoing, continuing resolutions carrying it forward year after year after year. And now we have the Older Americans Act of 2014 that was put on the floor of the Senate by Senator Bernie Sanders of Vermont.
We also want, the message here today is to celebrate the 49th anniversary, but also to improve it, to protect it, and expand it to everyone.
Medicare has many advantages, but one of the best advantages I feel is the fact that I am able to choose my own doctors and my own care.
It takes care of the vision as well as hearing and all the rest of the things that go with it.
When I was in the hospital in the emergency room, I had to have x-rays and I had to have all these different tests done. And when they discharged me the next day, they just discharged me, but Medicare had paid my bill.
And we've got to continue to go ahead and have that as a theme for our nation to continue to build on. Young, old, this little child here, all of us deserve health care in dignity. And it should be provided by our nation for the betterment of all our society.
The reason why I don't have Medicare, it's because I am an undocumented person.
I have been denied health access or been overcharged just for not having the right documentation. And I mean documentation by not having health insurance and by not being, I guess, a legal person in this country.
I would love to have Medicare because that would help me get access to better treatment for my condition, which is a cerebral palsy. I could get access to new crutches because I've had the same crutches for about 5 years now.
Now, without that Older Americans Act, we're not going to have any of these. It covers housing, Medicare, Medi-Cal, the Department of Aging and Adult Services, stick and learn about the Older Americans Act and support it and further a campaign to get it passed. There's a floor number for it in the Senate, but there is no date for it to be heard on the floor. And in the House, it just sits there.
And we're going to continue that fight in California and join us also at the federal level, joining CARA and other groups to push for health care for all, single payer. That's what we would like to see in the future. And so that you have access to your doctor and you don't have to, talk to an insurance company to see what you have health care coverage and what you don't.
When I broke my arm, I was able to go to the best doctor, and he did a wonderful job on my hand.
With my other plan, they choose the doctors. But with Medicare, I choose the doctors that I want to go to.
I broke my arm, my upper arm, and Medicare paid for all of the repair. It paid for the surgeries, the medications, and everything else that had to be done to rehabilitate my right arm.
It's covering millions of folks that are elderly and disabled. But guess what? In Congress, there's conversations about Medicare.
Medicare has made a difference in my life because it has allowed me to maintain my health, which in turn has allowed me to continue to be productive, active in my community, and contribute.
I don't know what I would do if I didn't have Medicare.
So I really want to thank everyone for being here today. We should continue funding health care. So thank you so much.
Testing, 1, 2, 3, testing, 1, 2, 3.